Good day, everybody. I'm Dr. Joshua Weitz. I'm CEO and Clinical Director at Dermatology Associates of Rochester, coming to you from Rochester, New York, which is the western part of New York State. And I'm excited to be able to join you and talk a little bit about the Plasma IQ with this Nuvia Pill of Science. And so I think that you will enjoy it. And without further ado, let's chat about the Plasma IQ. So as you most likely know, the Plasma IQ is a portable microelectrosurgery device. I'm pleased to announce that we have the FDA approval or FDA clearance in the United States as a Class 2 device. We have two of these in our clinic. One is a device that I carry. I carry it in my pocket. Our plastic surgeon, Dr. Calvin Young, carries one in his pocket as well. It's fantastic because the portability allows us to add this on for our patients as part of their neurotoxin or filler treatments. You add a little bit of numbing, which we'll talk about in a minute, and can really deliver some nice results in a very short amount of time. The way the plasma device works is it creates what's called a plasma arc. And there are two energy settings on the system, and the settings basically allow for an electrical current to flow. And as you come close to the surface of the skin, you generate this plasma arc, which results in skin sublimation. As you know, sublimation is basically an ablative process or results in an ablative process that destroys some of the very superficial layers of the skin up in the epidermis down to the stratum corneum. But you also get some deeper heating that's controlled at the level of the dermis. As we generate the plasma arc and deliver energy to the surface of the skin, in this pictorial, you can see in the three steps the different things that are happening below the surface of the skin. So at the top most superficial layer, we have the skin sublimation. There's an immediate tightening that takes place in that particular targeted area. And you'll observe a tiny brown crust that forms almost immediately. This tends to exfoliate over the next 1 week, week and a half, basically 7 to 10 days. As we think a little bit deeper down into the dermis, the heat that is generated from the treatment allows for the stimulation of what are called heat shock proteins, which ultimately result in collagen or neocollagenesis. As far as the long-term effects, it's basically a byproduct of the neocollagenesis. And ultimately, we're going to see a tightening and improvement in fine lines and wrinkles of the targeted treatment area. These are some of the favorite areas for patients as we think about, what kinds of problems are patients coming into the clinic with, and what are the areas that we're going to target. The hooded lid, crow's feet, the area under the eyes, the kind of fine lines and wrinkles that form there, as well as skin tags, stretch marks, and perioral wrinkles, smoker's lines, lip wrinkles, the things that many of our patients come in with concerns about that perhaps the dermal fillers don't necessarily address as well as they would like. This becomes a nice add-on. As you can see, the indications for this non-surgical blepharoplasty as performed with the Plasma IQ include mild to moderate laxity of the upper and lower eyelids in the absence of lipoptosis, wrinkles, patients who have crow's feet that perhaps don't want botulinum toxin injection, or I find that I'm frequently using this for patients who have both dynamic as well as static rhytids. So if they have resting wrinkles, and we know that neurotoxin is not going to get rid of those resting wrinkles, adding Plasma IQ as part of their treatment program will help eliminate the appearance of those lines, even with the neurotoxin treatment. Anybody who refuses surgery, and then patients, obviously we live in a world now where people want to have non-invasive, non-surgical approaches. This is a great device because it allows us to give a very nice result that's minimally, non-invasive to minimally invasive with little to no downtime. As far as the treatment technique, it's quite straightforward. So as you can see here, you're going to apply a topical anesthetic to the treatment area. In this case, we're showing the upper eyelids, although this would apply if you were treating lines around the mouth, the crow's feet, or even just a skin tag. Once you've reached your incubation time, you're going to clean and circle the treatment area. You're never going to use a colored pen or pencil of any kind. You're going to use, white eyeliner or just visualize it yourself. As we think about treating the upper eyelid in particular, we're going to kind of lay down a random network of dots and basically address the wrinkles of concern in the areas of the eyelid that are not moving. And so we'll clean the area with either um, sterile saline or a disinfectant agent that does not contain alcohol. We use a hypochlorous acid. And then you're going to apply, after treatment, the Plasma IQ mask for gentle soothing of the recently treated area. Here we have a nice video. Let me get this queued up. So this video is going to show us the technique. As you can see here, the patient is comfortably at rest, and this is having used just the topical numbing agent. There is a 90-degree bend in the tip that is coming into contact with the surface of the skin. This probe is a steel probe. As I mentioned, you have two energy settings on the handheld device. There is high and low. What is being demonstrated currently as you're watching it is the low energy setting. You'll notice that we've kind of identified the superior eyelid crease as a line of demarcation. As I mentioned, we're treating the lax skin tissue that's really non-moving and is not part of the immediate superior border of the eyelid margin. Here we've applied traction to show some of the skin that has been folded over. And you'll notice that the random dot matrix that I mentioned is being applied with approximately 1 second of energy delivery to each of the locations that are being made contact with by the probe tip. This, again, is the sublimative process. So that little plasma arc is where the sublimation is happening. The carbon crust that's forming is, as I mentioned, the immediate byproduct of treatment that will typically fall off or exfoliate all by itself with just gentle care, soap and water, gentle cleansing, light pressure, nothing abrasive. And these little carbon crusts, as they resolve over the next 7 to 10 days, will leave behind a faint line or dot matrix where you can see that the patient had treatment. In my experience, this typically resolves within just a couple of weeks in patients who are Fitzpatrick skin types 1, 2, or 3. Patients who are Fitzpatrick skin types 4, 5, or 6 may experience a little bit of post-inflammatory hyperpigmentation, and so they should be made aware of that prior to the procedure. That has historically resolved in all of our patients that we've treated. If it does occur, it's again very, very rare. As we're laying the dots down onto the area of treatment, we're trying to keep them approximately 1 millimeter apart. Here you see that in the medial border along the nasal bridge, there's a skip area. That skip area is a small area of xanthelasma, which we'll demonstrate here in a second how we can address that as well as part of the treatment. Oftentimes, when I'm performing this treatment, I'll notice that, the patients will have a slight twitching to the upper eyelid. This is usually involuntary, and they'll describe the sensation as a mild tickle, but overall the comfort is quite good. And here you can see the untreated side versus the treated side. You'll notice that on the treated side, there's already a little bit of swelling that can increase somewhat over the subsequent days. Here you see the high power setting treating this area of xanthelasma. And so this is continuous treatment, almost in lateral back and forth motion to address. You're making careful to note that you've addressed the area, but not gone so deep as to cause injury to the lower structures. Here we have our treatment protocol. So as we think about our treatment, it's quite straightforward. If we're thinking of how often should the patient come in, it's approximately every 4 weeks or about every 30 days. Excuse me. You're typically going to be performing between 1 and 4 treatments per area per patient. And so depending on the age of the patient and how well they respond, you'll kind of make a determination of what's best for that individual. We find that for our patients who are 40 years of age or younger, typically 2 to 3 treatment sessions is appropriate. Patients who are 40 years of age or older, typically 3 to 4 or even 5 sessions is appropriate. If we're thinking about scars or stretch marks, we're going to address that on an individual by individual basis, depending on how severe the scar or stretch marks are. And obviously, if there is any sign of redness or different skin texture following the first or second or third treatment, you'll want to basically postpone treatment by 2 to 4 weeks so that you can allow for maximal healing of the area. So with that, I thank you very much for tuning in. I hope this was informative, and I invite everybody to complete a short quiz here about Plasma IQ. Have a wonderful day.